Have you been told you need a total knee replacement, but you want to see if you can avoid it or delay it longer? Do you want to learn how to feel better with some simple exercises? We have helped many clients avoid knee surgery and get their life back to feeling better. Before we get into this video, make sure you subscribe for more health videos. And if you're experiencing knee pain or have any tips to share, please leave a comment below. Knee health is something that is really important to me, and I am sure to many of you out there as well. As we age, our knees can start to weaken, and it's not uncommon to experience pain and discomfort. But did you know that there are simple exercises you can do to help strengthen and improve the mobility of your knees and even reduce your pain? Today, I want to explore some other alternatives to a total knee replacement surgery. Knee pain is a common issue that many people face, especially as they get older. According to a recent statistics, over 700,000 knee replacement surgeries are performed every year in the United States alone. But what's alarming is that number is projected to grow exponentially in the coming years. I've had 3 of my friends in their early 50s that just had a knee replacement. That's just way too early. But what's behind this trend? One of the major factors is the increased prevalence of obesity that puts extra strain and weight on your joints. Another factor is the doctors are relying on MRIs and X-rays to determine if you need any type of knee replacement. We've had a recent client come into our office in her early 50s that was told she needed a partial knee replacement on the lateral side of her knee. After the evaluation, we found that her issue was the joint below the knee called the tib-fib joint. Mobilizing that area gave her significant reduction in pain as well as mobility in just one visit. We now have a game plan and she's on the road to recovery without surgery. The good news is there are steps that we can take to prevent knee pain and reduce the risk of needing surgery. By incorporating these simple exercises into our daily routine, we can strengthen our knees and improve our mobility and reduce the reliance of being on pain medication. So let's get into some research that's really interesting on people that were in line to having a total knee replacement. Now, this research was done in Canada. It was published about probably 10 years ago. But what they did was they took people that were in line to have a total knee replacement, and they went and they looked at their mobility and they put them into a category of, okay, we're going to be doing some joint mobility stuff with you, or we're going to put you into a strengthening category if they didn't notice any kind of mobility changes. And so what they found was, of the people that went into that mobility category where they either did extension mobs or flexion mobs, one direction or the other direction, they work differently, and some people respond better to extension and some people respond better to flexion. And what they found was that they got improvement, significant improvement in their function, their pain, their mobility, and then being able to get back to doing their activities in a very short period of time. It was like 2 to 3 weeks. They did not need to have a total knee replacement. And the number of people that were in line to have total knee replacement, 40% of them did not need to have it, like with these simple exercises that I'm going to show you. And so you've got to really get into someone that kind of understands this and understands what you need to do. We're going to show you some exercises that you can do. So the first phase is always looking at mobility. Because again, like I say, if your mobility is not there, now there can be issues where people have mobility issues and it's just, they're not going to get any more in their knee. I'm one of those cases. I have a lot of issues in my tib-fib, so I don't have full range of motion here, but I am able to run and jump and do everything I want to be able to do. So you are going to notice some things like that, but I have used these exercises to help my knee when it does act up a little bit. So let's go into the first thing. Let's go and look at your range. So when we look at our range, we just want to get baselines. So can we move it all the way in? So if this is my bad side, then I want to make sure I can bring it all the way in. If I can't, and it's like, nope, it's stuck, or it's painful, or it's kind of painful when I do this, those are things that you just need to pay attention to. The next phase is looking at your extension. So if you can lift the leg off, or if you notice that like my knee has a space in between here, that's not normal, especially if the other side is all the way down. So you want to go and see, can you get that extension? Can you get the heel off the ground? And if you can't get the heel off the ground, or there's a big difference between one or the other, then you also notice that there's some issues in that direction. Definitely if your knee is bent and you can't get it all the way straight, that's a problem. we need to address that, because you fully can't get your muscles to fire without getting full knee extension. So when you take those baselines, I'm going to show you the 2 knee mobility exercises that you can do to start improving your joint. Now, the first one will be going into extension. A lot of times we move the joints into extension because how are we throughout the whole entire day? We're sitting, our knees are always bent. They're never fully straight. And so if we're always having our knees bent in this direction, you can have some issues within those joints. Now, a lot of times we'll see people that'll have issues if they've been kneeling a lot. They may have these kind of issues as well. Again, knee extension usually is the direction that you want to go into. So how you're going to do this is you want to put the foot turned to the outside. So if my foot, you're going to rotate it to the outside, because to get that full knee extension, it actually rotates in. So we're going to add a little rotation already. So we're going to put the foot facing to the outside, and then we're going to take our hands above the kneecap. You don't want to be pushing on the kneecap, not comfortable at all. So you'll feel the bone that's in the kneecap here. You want to be above that. And you're going to take your hand and literally rotate the leg to the inside, and then use your body weight to kind of push it back. So you can do it where you hold that position and just hang out there. A lot of times that works really, really well, almost better than like going into it and coming out of it. And so you'll go in and you can either holding it for 10, 15 seconds, come out of it, do it again, doing it like 6 to 10 times, go back in, and then go and see what your range looks like. So if your range is, oh wow, that's actually better, that feels better, actually I can straighten my leg a little bit better, then you know you're moving in the right direction. Now, the interesting thing with this research study, where these people's knees, like they were an older population that was waiting for the knee replacement, and that they found that if the knee was a little bit more degenerative, that flexion was actually the direction that improved them. So we're going to show you that mobilization as well. Now, I love to use a towel to put behind the knee, because when you bend it, it's going to help open up that joint a little bit more. It'll feel a little bit more comfortable. So what you're going to do is you can put your foot on a chair and do this. I'm going to do it in kneeling just to kind of show you. So I'm going to get up here, put my leg in a kneeling position. We're going to put the towel roll underneath here, and I'm just going to mobilize it, bending into the knee, trying to stretch into the knee. Now I can use my hands to kind of hold me up. The beauty of this is you're going to get some mobilization in that ankle as well, which also can cause a lot of issues in through there. So you'll just kind of pressure on, go to the point like, ooh, yeah, I kind of feel that stretchy pain, then come out of it, go back into it. Again, you can hold it a little bit. You can go in and out of it. Do it about 6 to 10 times. Go back in, check your range of motion to see if you notice improvement. If you have a mobility issue where your knee is not moving fully, you're going to want to start out with these exercises first, because if you fully can't move, you're not going to be able to get your muscles to fire to begin with. So it's always our first phase of treatment is making sure that things are actually moving. Now, when we get to where things are starting to move and we want to work on getting the strength back, a big common area that is problems for people is the muscle right through the top of that kneecap. So the muscles that it's part of the quad that go that attach into that kneecap. So it's probably a section this big. It becomes more degenerative. And what do I mean by that? I mean, there's not a blood supply that's going to those muscles. It's basically stopped healing. It's just kind of done. So every time you use your muscles, it pulls on the knee bone, making you feel like there is knee pain, like arthritic type pain. It's really common. We see it all the time. Now, if that's the case, you know, this first exercise we're going to do is going to start working on trying to get these muscles to start firing again, but in a non-weight bearing area. It's an area that is always super weak on people as well. So what you'll do is you're going to lift the leg all the way up. Now you can start out with no weights, and then you can start adding some ankle weights, but you're just going to bend the knee a little bit and then come straight back up, and then bend the knee a little bit and then come straight back up. This is working these muscles close to that kneecap. So you'll go down and then you'll come back up. Just like this. So again, you can do no weight starting out. You can add, 3 pounds, 5 pounds. You can increase the weight that you want, but that's really working on getting these muscles to kind of fire closer to that knee, which are a very weak muscles. Now, the next exercise, hips are a huge part of the knee and allowing the knee to be in a good position. It takes the hips, strengthening the hips to kind of work on helping stabilize that knee. So we're going to do a hip exercise. And what you're going to do is you'll put the foot out like your heel is up against the leg and the knee's bent out a little bit. You're going to keep that knee bent out. You're going to go in a 45-degree angle, really getting those muscles to fire in that glute. So again, you'll pull out, kind of coming out, coming back in, coming out. Again, doing these 10 times, 2 sets, really feeling those glutes firing. Do them on both sides. You're going to feel both sides working because you literally have to stabilize one side to move the other side, but they're great exercises that you can do for the hip. Now, we also have clients, much like myself, who had a lot of degenerative tissue and who also has issues within the knee because they literally have abused their body. That's me, where Shockwave is a treatment that we're getting phenomenal results with when people have knee pain, especially if there's degenerative changes. So what we find is, again, there's degenerative changes within that muscle that's just above the kneecap. So we do Shockwave through there, basically bringing revascularization so that it starts the healing process over again. Because this body, you've stopped healing in this area. And so it'll start that healing process again to where you can get some of those muscles to fire. The other part of it, we have focused Shockwave that actually can help with bone, healing bone. When you have arthritic changes in that knee, you don't have a good blood supply to that area, so you get a lot of bony edema and pain. This will knock a lot of that out to where then we can start working on getting things stronger. So we are, again, one of the few people in the DFW area that actually has this technology, but it's a game changer on keeping people out of the surgical room and back to feeling great. Again, if you like what we are sharing, make sure you subscribe to our channel, share this with someone that needs to hear this message, comment below with your experience on what you've tried and what's worked and what hasn't worked, and we're always here for any questions that you have.